Alright, so whenever you have to irrigate with sodium hypochlorite, make sure that you use lower lock syringes. That means the ones that lock properly. Otherwise, when you apply pressure, they can open and hypo will splash everywhere. So I have removed this needle with which I have given inferior alveolar nerve block, and I am going to replace it with 30 gauge needle that is ideal for irrigation, especially with hypochlorite, sodium hypochlorite. This is a 30 gauge side vent needle. Now what we are going to do is load it with sodium hypochlorite safely. Make sure it doesn't touch any of the surfaces like your clothes, especially because it is going to damage them. Now there should not be anything dripping from here. It should lock properly, and this is how you irrigate.
Make sure your needle doesn't bind in the canal and it should move freely in up and down motion within the canal. Make sure that you do not forcefully press the plunger, otherwise there are chances of apical extrusion of sodium hypochlorite. Make sure your needle reaches the apical 1/3 of the canal, because that area also needs to be cleaned properly and not just your coronal and middle 1/3. But at the same time, you need to be very careful not to extrude the sodium hypochlorite beyond the apex.